you have accommodation.
Start with eyes again.
Okay, so looking, now I'm going to look at the eyes. When I look at the eyes, I'm looking at the sclera to make sure it's white. I'm looking at the cornea to make sure that it's clear, there's no fogging. And then the next thing I'm going to do is I'm going to look at the conjunctiva. I'm going to ask them to look up. Would you look up for me, please? I'm going to put down the eyelids, and I'm looking at the conjunctiva to make sure it's pink. Next part of this is accommodation. I'm going to hold this out. So would you look at the pen, please? So I'm going to bring it in slowly. Now when I bring it in, I'm looking for two things. One is I'm looking for both eyes to close in on the pen. The other thing I'm looking for is to watch the pupils contract. I pause here for a moment, and then I bring it out to see the pupils relax and watch the eyes come back. Next thing I'm going to do is I'm going to use my light. I'm going to check the pupils. Make sure they're what's perla, right? The pupils are equal, round, reactive to light. I already did the accommodation, so now I'm looking at the pupils. I'm watching the pupil constrict. That looks good. The next thing I'm going to do is ask them to look up. Look up, please. I'm going to look at the mucosa of the nose to make sure it's clear. And it's clear. It looks good. The next thing I'm going to do is I'm going to ask them to open up your mouth. Open your mouth, please. Just give me a grin so I can look at your teeth. I'm looking at the teeth. I'm looking at the gums. Open your mouth, please. I'm looking at the inner mucosa of the mouth. It looks good. I'm looking at the hard palate, the soft palate. I'm looking at the tongue. Stick out your tongue, please, and say ah. I'm looking at the tongue. And I'm going to look at the tonsils and I'm going to make sure that they look good. And I'm going to look at the uvula to make sure it's midline. And that when you swallow, please. Well, yeah, swallow, open your mouth. Say ah. And that the uvula raises. It's midline. Next thing I'm going to do is I'm going to look at the ears. I'm looking for excess cerumen. I'm looking to make sure the ears look clear. Also that the ears themselves are the same color as the rest of the skin. Those look good too. Next thing I'm going to do is I'm asking them to look upwards. I'm going to make sure the trachea is midline. I'm going to feel for the thyroid. I'm going to palpate the thyroid. That's good. Now, next thing I'm going to do is I'm going to palpate for temporal pulse. Both sides. I'm going to palpate the carotid artery. Both sides. Now I'm going to palpate for lymph nodes in front of the ear, behind, occipital. Got the sternal-mastoid muscle here. Palpate the lymph nodes there. I'm going to come down, then right here on top of the clavicle. Okay, after that, I'm going to test and I'm sending under the jaw. Good, I needed help, thank you. Okay, so now I'm going to test for muscle strength of the neck. Would you look to the right for me? Left. Chin down to your chest. And look up for me. Good. Okay. So, have I skipped anything? No? Everything was good so far? Okay. So next thing I'm going to do, without making you take off your shirt or anything, is I'm going to listen for heart sounds. So, to find your landmarks, you've got that. You've got the notch. You've got the ridge. What's that? The sternal ridge. So that ridge, the second rib connects to that. You want to go to that. The second intercostal space. That's your aortic. So you listen to your aortic. The second intercostal space on the other side is pulmonic. Third intercostal space is Erb's point. Fifth intercostal space bordering the sternum is the tricuspid. And also fifth intercostal space, mid-clavicular line below the nipple, is your mitral. Here is also where you get your apical pulse. And what you'll do for a count of 30 seconds, multiply that times 2 to get your full minute.
We hear sounds.
Huh?
We hear sounds.
Oh, and then, yeah. So S1, this is also S1, right there at the mitral. And S2, sound 2, is at the pulmonic, pulmonary. Yeah, pulmonary. Okay, so now I guess listening to your breathing sounds. Listening to your breathing sounds, you want to go for your intercostal spaces, and there's about I'm gonna say four pairs. So going to intercostal space, so it's 1, 2, 3, 4, 5, 6, 7, and 8. Okay. There's no points in particular. I can tell you that your lungs start about 3 to 4 centimeters above your clavicular line, and that you're only going to go far down as the 6th rib, the intercostal space above the 6th rib. So you come around to the back. So up here, there's about 5 pairs. So you start up here up on the trap, below the shoulder blade. This is going to be like hourglass in shape. So it'll be 1, 2, 3, staying off the shoulder blades. 4, 5, 6, 7, 8, and then on the sides 9 and 10. Next thing I'm going to do is I'm going to ask them to bend over, please. Just expose the spine. I'm going to check spinal alignment. Just sit up straight, please. I'm going to grab right here, just at the bottom of the rib cage. I'm going to push my thumbs together. Well, I'm going to have my thumbs touching. I'm going to ask them to breathe so that I can see them expand. And what's supposed to happen is that my thumbs will separate with their expansion. Deep breath, please. All right. Then while I'm back here, I'm going to test for hearing. I'm going to do the whisper test. 2-syllable word is what you'll whisper. They're supposed to repeat it back. Apple. Apple. Of course, I'm not exactly whispering, but you're supposed to whisper. And then apple. Apple. 2 different words, but anyway. So after that, I'm going to do. So what would I forget? So an observation that you're supposed to make is that the rib, the anterior posterior, what's it called? The anterior posterior.
The
thoracic. That the width of this rib cage is twice the depth. Okay. So the next thing I'm going to do is I'm going to do a skeletal muscular test. So grab my fingers, squeeze. No, like this, please. Squeeze. All right. It's testing strength. Hold your arms in like this. Don't let me pull out. Put your arms out. Don't let me push down. And while I'm here, I'm also going to do the brachial pulse. Right. I'm going to do radial, both sides. Brachial, radial. I'm also going to look at the hands. I'm going to look at the fingernails. I'm going to look at, the condition of for clubbing. And if a person's anemic, you're going to have spooning. I'm also going to look at the skin. I'm also going to, for warmth, coloration of fingertips, warmth on both sides, using the back of your hand. For that capillary refill, it's got to be less than 2 seconds, 3 seconds.
Depends on who you ask.
Less than 3 seconds, capillary refill. Capillary refill's good. So the next thing I would do is I would have the patient lay down. Yeah, best you can. And at this time, they would have their socks and shoes off. And from there, I would, when they have their feet out, I would have them point their toes up. When their toes up, I would have them push up against. I'd have them to push up against me. All right. Then next thing I do is I have them point their toes. Then I have them pull up. Okay. It's at this time that I would do leg lift. There you go, man. Scoot back, man. You ain't got to do some serious leg lift. There you go. So at this time, I would do the tibial pulse on both feet. I would do the dorsal pedis pulse which is between the big toe and the next toe. I would do capillary refill. I would be testing temperature using the back of my hand to make sure it's warm. Okay. There's the palpate pulse. Normally you can't find that though, but you test for it. Then there's also you have your
femoral.
What are these called?
Femoral.
Yeah, you've got your femoral pulses. And one thing that I forgot to bring up was testing for skin turgor. Okay, now when I was looking at the hands earlier, when the guy was sitting up, I would have done skin turgor on both hands. That's the test for moisture. And then I'm gonna do the skin turgor here on the feet. I would test for edema by pressing on the shin, releasing, and what was it? I guess it was 2 millimeters, 3 millimeters. Anyway, if there's a dip there, the guy's got edema. Okay, so now while they're down, I would look at the rib cage. Feeling for the angle of the rib cage. Less than 90 is a degree less than 90 is what you want. Next thing I do, I guess I would look at the abdomen. I would see if it's flat, if it's concave, if it's rounded. After I've done that, I would listen. And when it's divided into 4 quadrants, and the rule is that if you don't hear anything, then what you're supposed to do is stay 5 minutes in each quadrant, listening for bowel sounds. So 1, 2, 3, 4. Then after that, you palpate. Well, the right upper quadrant is where you've got your liver. Feeling for, is that right? That's right, isn't it? Yeah.
Feeling for masses.
Looking around. Huh?
Masses.
Yeah, feeling for masses. Does this hurt? This should not be uncomfortable. I got talked on. Nope. Okay. So I didn't feel anything. And then from here, I guess I get to asking questions like, when was your last bowel movement? Constipation, diarrhea, any blood in the stool. I'd ask about urination. Was there any discharge? Did it smell? Coloration. Then also from here, you would, I guess if it's a woman, you have the breast exam. You'd ask the frequency that they do that, and if they do it, and if not, you would coach on how often it's done. Once a month, circular motion, starting with the nipple and working out. For a man, a testicular exam once a month. Grabbing, holding the testicle with one hand, preferably in the shower, and feeling for any masses on the testicle. Did I forget anything?
How long should you listen to a stomach? What's normal to hear
so,
sounds?
So what you want to do is you're just listening for a sound.
Is 30? If you hear it within 30 seconds, is that considered normal active?
Yes. And that's it.
All right.